Most seniors dismiss small health changes as normal aging, but your body speaks to you in whispers before it starts to shout. Recognizing these subtle warnings could literally save your life, and today we're covering 5 critical signs you should never ignore, no matter your age. These aren't just minor inconveniences, they're your body's way of alerting you to potentially serious conditions that require medical attention. The difference between addressing these signs now or later could be the difference between simple treatment and major intervention. Many seniors hesitate to bother their doctors with what seems trivial, but remember, early detection remains your strongest ally against serious illness. That unusual symptom you've been dismissing might be the very clue your doctor needs. For every senior watching, and for loved ones concerned about their elderly family members, this information isn't meant to frighten but to empower. Knowledge truly is power when it comes to your health. Let's explore these 5 warning signs together so you can recognize them immediately, understand their importance, and know exactly when it's time to seek medical help. Your future self will thank you for paying attention today. Each sign we'll discuss has been identified by medical professionals as particularly significant for older adults. These aren't random complaints, but specific indicators that deserve your full attention. The good news is that addressing these signs promptly often leads to better outcomes and simpler treatments. Waiting too long, however, can sometimes limit your options and complicate recovery. As we age, our bodies change in ways that can mask important symptoms, making it even more crucial to stay vigilant about these specific warning signs. What might be minor in a younger person can signal something serious in seniors. Remember, this information isn't a substitute for professional medical advice, but rather a guide to help you make informed decisions about when to seek care. Your health journey is unique, but these warning signs are universal. Let's begin with our first critical warning sign, one that many seniors dismiss but doctors take very seriously. This symptom alone could be the key to early intervention for several serious conditions. Losing weight without trying might seem like a gift, but when pounds disappear without diet or exercise changes, your body may be sending a serious distress signal. Unexplained weight loss in seniors, particularly losing 5% or more of your body weight within 6 months, should never be ignored. Many serious conditions first announce themselves through unintentional weight loss, including various types of cancer, thyroid disorders, digestive issues, and even early stages of dementia. Your body requires certain calories to maintain basic functions, and when something interferes with this process, weight drops unexpectedly. What makes this warning sign particularly dangerous is how easily it can be misinterpreted as positive. Friends might compliment your slimmer appearance while you secretly worrying about pants that suddenly feel loose. Trust your instincts if something doesn't feel right. For seniors specifically, unexplained weight loss can indicate malnutrition, which weakens the immune system and makes you more vulnerable to illness and falls. It may also suggest difficulty preparing meals, problems with dentures, or decreased appetite due to medication side effects. Cancer often causes weight loss through increased metabolism, reduced appetite, and changes in how the body processes nutrients. Early detection dramatically improves outcomes for most cancers, making this warning sign particularly valuable. Digestive disorders like celiac disease, inflammatory bowel disease, or pancreatic insufficiency can prevent proper nutrient absorption, causing weight to drop even when eating normally. These conditions are manageable when properly diagnosed. Thyroid problems, particularly hyperthyroidism, speed up metabolism and burn calories faster than normal. This is easily diagnosed through simple blood tests and can be effectively managed with medication in most cases. Depression and anxiety, often overlooked in seniors, frequently manifest as decreased appetite and subsequent weight loss. Mental health treatment can address these issues and restore healthy eating patterns. Diabetes, particularly undiagnosed type 1 or advanced type 2, causes weight loss when glucose cannot enter cells properly, forcing the body to burn fat and muscle for energy. This requires prompt medical attention. Heart failure can lead to unexpected weight loss through increased metabolic demands and changes in appetite. This condition responds best to early intervention, making weight changes an important warning sign. Medication side effects sometimes cause nausea, taste changes, or decreased appetite. Your doctor can often adjust dosages or switch medications to address these issues if informed promptly. Dental problems or poorly fitting dentures can make eating painful or difficult, leading to reduced food intake and weight loss. Regular dental care remains essential throughout life. Struggling to catch your breath during normal activities isn't simply a sign of aging, it's your body urgently signaling that something needs attention. Shortness of breath, also called dyspnea, becomes concerning when it occurs during activities that previously caused no breathing difficulty. Many seniors mistakenly attribute breathlessness to just getting older, but sudden or progressive difficulty breathing often indicates underlying cardiovascular or respiratory conditions that require medical evaluation. Dismissing this symptom could delay treatment for serious, yet manageable conditions. Breathing should be effortless and unconscious, even in later years. When simple tasks like climbing a short flight of stairs, carrying groceries, or walking to the mailbox leave you winded, your body is sending an important message that shouldn't be ignored. Heart conditions often first present as shortness of breath, particularly heart failure, which occurs when the heart cannot efficiently pump blood. This causes fluid buildup in the lungs, creating the sensation of breathlessness, especially when lying flat or during minimal exertion. Cardiac issues require prompt attention, as early intervention dramatically improves outcomes. Treatments range from medication adjustments to more advanced interventions, but all depend on timely diagnosis. Chronic obstructive pulmonary disease (COPD), which includes emphysema and chronic bronchitis, commonly causes breathing difficulties in seniors. Current or former smokers face higher risk, but anyone can develop these conditions which respond well to proper management. Asthma, often thought of as a childhood condition, frequently appears later in life or returns after decades of dormancy. Unlike younger patients, seniors with asthma may have less obvious wheezing but more pronounced breathing difficulty during activity. Pulmonary embolism, a blood clot in the lungs, causes sudden, unexplained shortness of breath along with chest pain and requires emergency medical attention. This serious condition can be life-threatening but responds well to prompt treatment. Anemia, a condition where you have too few red blood cells to carry adequate oxygen throughout your body, commonly causes breathlessness, especially during physical activity. Simple blood tests can identify this highly treatable condition. Sleep apnea, characterized by breathing interruptions during sleep, often goes undiagnosed in seniors. Beyond causing daytime fatigue, this condition stresses the cardiovascular system and requires proper management to prevent complications. Anxiety can trigger breathing difficulties through panic attacks or chronic stress responses. While the physical sensation is real, understanding the mind-body connection helps in developing effective management strategies. Occasional forgetfulness happens to everyone, but persistent confusion or significant memory changes should never be dismissed as normal aging. For seniors, new or worsening cognitive difficulties often serve as important warning signs that something requires medical attention. Many assume cognitive changes inevitably accompany aging, but significant memory loss, confusion, personality shifts, or difficulty with familiar tasks actually signals that something beyond normal aging may be occurring. Recognizing these changes promptly can lead to earlier intervention. Sudden confusion, sometimes called delirium, particularly requires immediate medical evaluation. Unlike gradually progressing dementia, delirium develops quickly, often over hours or days, and frequently indicates an acute underlying medical condition requiring prompt treatment. Urinary tract infections (UTIs) commonly cause confusion in older adults, often without the typical symptoms younger people experience. What might present as burning during urination in younger patients frequently manifests primarily as confusion or behavioral changes in seniors. Medication side effects and interactions rank among the most common reversible causes of confusion in older adults. As we age, our bodies process medications differently, sometimes leading to unexpected cognitive effects even with prescriptions previously well tolerated. Dehydration affects cognition surprisingly quickly in seniors, whose thirst sensation often diminishes with age. Even mild dehydration can cause confusion, disorientation, and memory problems that resolve with proper fluid intake. Electrolyte imbalances, particularly sodium imbalances, frequently trigger confusion or memory difficulties. These disturbances can result from medications, certain medical conditions, or inadequate nutrition and typically respond well to correction. Vitamin B12 deficiency, common among older adults, progressively affects memory and thinking while causing fatigue and weakness. Simple blood tests identify this deficiency, which responds dramatically to supplementation when caught early. Thyroid disorders, both overactive and underactive conditions, significantly impact cognitive function. Hypothyroidism particularly causes mental sluggishness and memory problems that resolve with proper hormone replacement therapy. Infections beyond UTIs, including respiratory infections and even COVID-19, frequently present with confusion or altered mental status in seniors rather than more typical symptoms like fever. The aging immune system responds differently to infectious challenges. Mini strokes or transient ischemic ataxias cause temporary confusion or memory problems that resolve within 24 hours. These events serve as critical warning signs for potential future strokes and require prompt medical evaluation. Pain that lingers beyond a few weeks deserves medical attention, not just over-the-counter pain relievers. Persistent pain serves as your body's alarm system, signaling that something requires professional evaluation rather than continued self-management. Many seniors grew up with the grin and bear it mentality toward discomfort, but modern medicine recognizes that chronic pain often indicates underlying conditions requiring diagnosis and targeted treatment. Ignoring persistent pain can allow these conditions to progress unchecked. Chest pain particularly demands prompt medical evaluation, as it may signal serious cardiovascular issues even when it seems mild or intermittent. Never dismiss chest discomfort as indigestion or muscle strain without professional assessment, especially when accompanied by shortness of breath, sweating, or radiation to the arm or jaw. Joint pain lasting beyond typical soreness might indicate osteoarthritis, rheumatoid arthritis, or other inflammatory conditions that respond best to early intervention. Modern treatments can significantly slow progression and preserve function when started promptly. Back pain affects most people occasionally, but pain persisting beyond 4 to 6 weeks, radiating down limbs, or accompanied by numbness or weakness requires medical evaluation. These symptoms may indicate nerve compression, spinal stenosis, or other conditions needing specific treatment. Abdominal pain signals various potential issues, from digestive disorders to organ inflammation. Location matters significantly. Upper right quadrant pain might suggest gallbladder problems, while lower left pain could indicate diverticulitis or other colon issues. Headaches occurring with increased frequency or intensity, particularly those awakening you from sleep or accompanied by neurological symptoms, warrant medical evaluation. New headache patterns after age 50 especially deserve prompt attention. Nerve pain, often described as burning, tingling, or electrical sensations, commonly stems from diabetic neuropathy, vitamin deficiencies, or nerve compression. These conditions require specific treatments beyond general pain management. Cancer sometimes presents as persistent pain in specific locations. Bone pain, deep persistent abdominal discomfort, or headaches with progressive intensity particularly merit thorough evaluation to rule out serious underlying conditions. Vascular pain caused by inadequate blood flow to tissues often worsens with activity and improves with rest. This pattern, called claudication, particularly affects the legs and may indicate peripheral artery disease requiring prompt treatment. Medication side effects sometimes cause persistent pain through various mechanisms. Statins occasionally cause muscle pain, while certain blood pressure medications may lead to joint discomfort. Your doctor can explore alternative options if medications contribute to your pain. Changes in bathroom patterns might seem embarrassing to discuss, but these shifts often provide early warning signs of important health conditions. For seniors especially, alterations in urinary or bowel habits deserve prompt medical attention rather than silent accommodation. Many assume bathroom changes naturally accompany aging, but significant shifts in frequency, urgency, appearance, or comfort level often indicate underlying conditions requiring specific treatment. Recognizing these changes early typically leads to simpler interventions and better outcomes. Increased urinary frequency, particularly when accompanied by urgency or nighttime awakening, may signal urinary tract infections, diabetes, prostate issues in men, or pelvic floor changes in women. These conditions respond best to early diagnosis and targeted treatment. Difficulty starting urination, weak stream, or incomplete emptying commonly indicates prostate enlargement in men. While often benign, these symptoms sometimes signal prostate cancer, making medical evaluation essential for proper diagnosis. Blood in urine, whether visible or detected only through testing, always requires prompt medical attention. This symptom might indicate urinary tract infections, kidney stones, or more serious conditions like bladder or kidney cancer requiring timely intervention. Urinary incontinence, whether stress incontinence leaking when coughing or laughing, urge incontinence sudden intense need to urinate, or overflow incontinence constant dribbling, responds to various treatments and should never be accepted as inevitable. Constipation becoming more frequent or severe deserves medical evaluation, as it may signal medication side effects, dehydration, thyroid issues, colorectal cancer, or neurological conditions. Persistent constipation sometimes leads to impaction requiring medical intervention. Diarrhea lasting beyond a few days, particularly when accompanied by abdominal pain or blood in stool, requires professional assessment. Such symptoms might indicate infections, inflammatory bowel disease, microscopic colitis, or medication effects requiring specific management. Changes in stool appearance, particularly narrow pencil-thin stools, black or very dark stools, or obviously bloody stools, serve as important warning signs potentially indicating serious conditions ranging from hemorrhoids to colorectal cancer. Pain during bowel movements, especially when accompanied by rectal bleeding, might indicate hemorrhoids, anal fissures, or more serious conditions. While hemorrhoids commonly cause such symptoms, only proper evaluation determines the actual cause. Unintended bowel movements or inability to control gas might indicate neurological issues, sphincter damage, or other conditions requiring specific interventions beyond general strategies for bowel management. Persistent sadness, anxiety, or personality changes aren't inevitable parts of aging but important warning signs deserving professional attention. Mental health remains as crucial as physical health throughout life, with emotional well-being significantly impacting overall quality of life. Many seniors grew up in generations where discussing mental health carried stigma, leading some to suffer silently with treatable conditions. Modern medicine recognizes that mental health changes often signal underlying issues responding well to appropriate intervention. Depression frequently presents differently in seniors than younger adults, with irritability, physical complaints, or cognitive changes sometimes more prominent than obvious sadness. These presentation differences sometimes lead to misdiagnoses without proper evaluation. Sleep disturbances, whether difficulty falling asleep, staying asleep, or sleeping too much, often signal depression or anxiety disorders. These changes affect overall health beyond simple fatigue, impacting immune function, cognitive abilities, and physical well-being. Loss of interest in previously enjoyed activities, sometimes called anhedonia, ranks among the most telling signs of depression in seniors. When hobbies, social gatherings, or favorite pastimes no longer bring joy, depression often underlies this change. Anxiety disorders affect many seniors, manifesting as excessive worrying, restlessness, muscle tension, or avoidance behaviors. These conditions respond well to treatment but frequently go unaddressed when assumed to be natural personality traits. Medication side effects commonly affect mood and mental health, with many prescriptions for physical conditions potentially causing depression, anxiety, or cognitive changes. Medication review by healthcare providers sometimes identifies easily addressable causes. Physical health conditions frequently impact mental health through various mechanisms. Chronic pain often triggers depression, thyroid disorders affect mood regulation, and cardiovascular disease sometimes causes anxiety symptoms through physical pathways. Nutritional deficiencies, particularly B vitamins and vitamin D, significantly influence mood and mental function. Simple blood tests can identify these deficiencies, which typically respond dramatically to appropriate supplementation. Social isolation dramatically affects mental health, with loneliness linked to depression, cognitive decline, and even increased mortality. This factor particularly impacts seniors experiencing mobility limitations, hearing loss, or transportation challenges. Grief from losing loved ones naturally affects emotional well-being, but complicated grief extending beyond typical bereavement patterns sometimes requires professional support. Distinguishing normal grief from clinical depression requires professional assessment. Regular health checkups serve as your first line of defense against serious illness, allowing early detection of conditions before they cause noticeable symptoms. These preventive visits establish baseline measurements for your individual health, making subtle changes easier to identify early. Many serious conditions develop silently for years before causing recognizable symptoms, including hypertension, diabetes, heart disease, and certain cancers. Regular screening detects these conditions during their most treatable stages, often before complications develop. Age-appropriate screenings vary throughout life, with certain tests becoming increasingly important for seniors. Your healthcare provider can recommend personalized screening schedules based on your personal and family medical history, lifestyle factors, and current health status. Blood pressure screening remains essential throughout life, but particularly crucial for seniors as hypertension prevalence increases significantly with age. This silent killer rarely causes symptoms until organ damage occurs, making regular monitoring vital. Cholesterol screening provides important information about cardiovascular risk factors, responding well to early intervention. Modern lipid panels offer detailed analysis beyond simple cholesterol numbers, guiding personalized prevention strategies. Blood glucose testing identifies prediabetes and diabetes, conditions affecting millions of seniors but frequently remaining undiagnosed for years. Early detection allows lifestyle modifications and appropriate treatment before complications develop. Cancer screenings, including colonoscopy, mammography, skin examinations, and appropriate gender-specific screenings, detect cancers at their most treatable stages. Guidelines for these screenings consider both the benefits of early detection and the risks of testing. Bone density testing becomes increasingly important with age, particularly for women after menopause and men over 70. This screening identifies osteoporosis before fractures occur, allowing preventive measures to maintain bone strength. Vision and hearing assessments help maintain quality of life and prevent complications from sensory loss. Untreated vision and hearing problems contribute to social isolation, cognitive decline, and increased fall risk beyond the primary sensory impacts. Medication reviews during regular checkups identify potential interactions, side effects, or opportunities to simplify regimens. This process grows increasingly important as medication lists lengthen over time. Immunization updates protect against preventable diseases particularly dangerous for seniors, including influenza, pneumonia, shingles, and tetanus. These vaccines require occasional boosters or annual administration for continued protection. Social connections profoundly impact health outcomes, with strong relationships linked to longer lives, better cognitive function, and reduced disease risk. For seniors, maintaining meaningful social engagement supports both physical and mental well-being beyond simple companionship. Research consistently demonstrates that socially active seniors experience slower cognitive decline, fewer depressive symptoms, better physical function, and even stronger immune system responses compared to more isolated counterparts. These benefits appear regardless of personality type or previous social patterns. Loneliness and social isolation increase mortality risk comparable to smoking 15 cigarettes daily, making social connection literally life-saving. This stark statistic highlights how crucial relationships remain throughout the lifespan, particularly during later years when social circles naturally change. Many seniors experience shrinking social networks through retirement, relocation, health limitations, and loss of contemporaries. Recognizing these natural transitions helps motivate intentional efforts to maintain and build new connections rather than accepting isolation. Technology offers valuable tools for maintaining connections despite physical limitations or geographic separation. Video calls, social media platforms, online communities, and messaging applications help bridge distances when in-person interaction proves challenging. Volunteering provides dual benefits of social connection and purpose, with regular volunteer activities associated with reduced depression rates, better physical health, and even reduced mortality risk. Contributing skills and experience provides meaningful engagement beyond simple social interaction. Community centers, senior centers, and religious organizations offer structured opportunities for connection through classes, meals, worship services, and special events. These organizations typically welcome newcomers and provide built-in social frameworks. Learning new skills or pursuing interests through classes, clubs, or groups introduces you to others with shared enthusiasm while stimulating cognitive function. Whether cooking classes, book discussions, gardening clubs, or art workshops, shared activities naturally foster connections. Intergenerational relationships benefit both seniors and younger participants through exchange of perspective, experience, and energy. Programs pairing seniors with children or young adults create meaningful connections across age boundaries. Pet ownership provides companionship shown to reduce blood pressure, decrease loneliness, increase physical activity, and create natural social opportunities through walking, veterinary visits, and interactions with other animal lovers. Nutritional needs evolve throughout life, with seniors requiring fewer calories but similar or increased amounts of certain nutrients. Understanding these changing requirements helps maintain muscle mass, bone density, immune function, and cognitive health despite age-related physiological changes. Protein becomes increasingly important with age, as muscle maintenance requires more protein per pound of body weight for seniors than younger adults. Aim for protein sources at each meal, including lean meats, fish, eggs, dairy, legumes, and plant proteins to support muscle preservation. Hydration remains crucial despite diminished thirst sensation that often accompanies aging. Dehydration occurs more quickly in older adults and affects everything from medication effectiveness to cognitive function and kidney health. Set regular water intake schedules rather than relying on thirst. Calcium and vitamin D work together supporting bone health, with requirements increasing after age 50, while dairy products provide calcium. Many seniors also benefit from supplements, particularly for vitamin D, which becomes harder for aging skin to synthesize from sunlight. B vitamins, particularly B12, become more difficult to absorb with age due to decreased stomach acid production. These nutrients support nerve function, energy production, and cognitive health, with deficiencies causing fatigue, memory problems, and neuropathy requiring supplementation. Fiber supports digestive health, helps manage blood sugar and cholesterol levels, and promotes healthy gut bacteria. Gradually increase fiber through fruits, vegetables, whole grains, and legumes while ensuring adequate hydration to prevent constipation. Healthy fats, particularly omega-3 fatty acids found in fatty fish, walnuts, and flax seeds, support brain health, reduce inflammation, and may help prevent or manage heart disease. These fats remain essential throughout life despite overall lower calorie needs. Antioxidant-rich fruits and vegetables combat oxidative stress, contributing to aging and chronic disease. Colorful produce provides these protective compounds, with darker, more vibrant colors generally indicating higher antioxidant content. Sodium sensitivity increases with age, with many seniors responding more dramatically to salt intake with blood pressure elevations. Reducing processed foods, reading labels for sodium content, and flavoring with herbs and spices instead of salt helps manage this risk. Medication interactions with food deserve attention, as certain prescriptions affect nutrient absorption or interact with specific foods. Grapefruit particularly affects medication metabolism, while some medications require timing around meals for proper effectiveness.